Good morning, everyone. My name is Nakacha Bridget, a clinical officer. I work with Pedro Pio Medical Services, Namasuba Masaja. We are here to give a health talk about pregnancy, and I'm with my colleague, clinical officer. I think he's going to introduce himself to us.
Thank you so much, Madam Moderator, for this show, for hosting me. I'm delighted and profoundly happy being in this place and discussing about pregnancy. My name is Kirabo Caleb Chimeze, a medical clinic officer, and I'm volunteering at Nakasongola Health Center 4. Thank you.
You are welcome.
You're welcome.
Mr. Caleb.
Thank you.
So we are going to talk about pregnancy today. We found it of importance. There are so many new mothers lately in these past 2 years due to the COVID era. Many girls have gotten pregnant, so we find it important that there is information that they need to know, and we want to bring it out. We are going to have a discussion amongst us. We're going to talk about pregnancy. What do you expect when you're pregnant? When can you get pregnant? How can you get pregnant? What are the complications of pregnancy? We are going to talk everything about pregnancy today. And starting from Mr. Caleb.
Yes.
What is pregnancy?
Well, Madam Moderator, before I define what pregnancy is, I'm just amazed by the topic you chose, and especially during this time we are in, COVID-19, where the teenage pregnancy has been at the peak, where some of them have least work to do, and they have been piled at home. The school-going children, the girls who used to go to school, most of them are at home, and this has actually led to the rise of teenage pregnancy or adolescent pregnancy. Yes, as stated. Well, pregnancy is a beautiful thing. When I think about it, I just see there are no endless definitions of it, but we can actually choose one. Pregnancy occurs when fertilization takes place. That is simply when a sperm, fertilizes an egg from the ovary, and later on it moves or travels to the uterus and it is implanted. Simply, that is pregnancy.
So basically, it's that time when an offspring or another human being, it can be either one or two, are growing into a woman, inside a woman.
Definitely that.
Yeah.
Actually, when you bring in a human being, one or two, that takes us to the point of multiple pregnancy.
Yes.
Yeah, well, where we can, last time I was watching news, and we saw one who gave birth to 4. The other one gave birth to 5. So when we have like 5 offsprings growing within the uterus, that is refers to as multiple pregnancy.
So a multiple pregnancy is when it's more than one.
Yes, more than one.
It can be 2, it can be 3, it can be 4, it can be 5.
Definitely.
Pregnancies or offsprings growing inside a woman.
Definitely.
So it can be 1
or 2.
It can either be a multiple pregnancy or just like one individual offspring growing into a lady.
Still talking about pregnancy, there is a point I just don't want to leave out. That takes us, when you talk about pregnancy, most of our focus is on the normal pregnancy. That is after the implantation of the fertilized egg in the uterus. There are some circumstances that we see, and they're also termed as pregnancies, or we can classify them. One of them is the ectopic pregnancy. That is a time where the egg or nothing is going to be implanted in the uterus, but it is going to instead be implanted in the tubes.
Outside,
yes.
Outside the pregnancy.
Yes,
anything
outside the uterus.
The uterus
yes.
is an ectopic.
Is an ectopic.
It can be in the abdomen, it can be in the fallopian tubes, it can be anywhere. So I want us to talk about the statistical data about pregnancy of now the past 2 years. Like we are hearing girl children are getting pregnant. You can hear a 15-year getting pregnant. Like, what do you think? Do you think there has been a rise in the number of pregnancies of late?
Yes, well, looking
at... Is it amongst the young ladies, the teenagers? Is it of the normal age?
Well, looking at statistics, it is kind of interesting, like I said before, that pregnancy, the rate at which people are becoming pregnant has been evident enough in the young people. The one I referred at the beginning as teenage pregnancy, we are experiencing a lot of teenage adolescent pregnancies, whereby if you try looking at the numbers, it is estimated that around 2.5 million females, yes, are becoming pregnant every year. And these people are estimated to be below the age of 16.
Yeah, that is.
Yes,
Yeah.
yes. Then, according to statistics as well, it is estimated that around 16 millions. These are people, these are females who are becoming pregnant, and they're around the age of 16 to 19,
Okay.
and sometimes to 20.
Okay.
Yes.
Yes, so lately there are so many pregnancies, especially teenage pregnancies. So I want to talk about, when does someone get pregnant? Who can get pregnant? What we should know is that any girl who starts her menarche or menstruation is capable of getting pregnant. So mainly, menstruation starts from the age of 12, around 12 to 15.
Yes.
Though there are those who can also start their menstruation at the age of 8. And when someone has had their first menstruation, meaning ovulation has taken place, if they go into sexual intercourse, because we get pregnant, it can either be sexual intercourse or it can be through technology, assisted reproductive technology, like IVF. So if someone undergoes any of that, if they have started their menstruation, they can get pregnant. So when can someone get pregnant? Because most of ladies, women there, they don't know when is the right period to get pregnant. Some people think that immediately after my period, someone can actually come to you and say, Misawa, I finished my period 2 days ago, I was with a man, and I want to test if I'm pregnant. But do you think that is possible? Do you think someone can get pregnant 2 days after their menstruation? So we want us to know when are the right days for someone to get pregnant.
Okay.
If you are looking for a child, someone can be looking for a child, but then they go into intercourse in the wrong timing. And they always say, so I'm not getting birth, I'm not conceiving, but because you're not targeting the time when you're supposed to give birth. So we want to talk about when can you get pregnant, because it's not every day or every time that when you're with someone, you'll get pregnant. Mr. Caleb.
Yes, sir.
Can someone get pregnant 2 days after their menstruation?
2 days after the menstruation, it is rare. It is rare.
It's actually not possible.
Yes, because during that time, we assume that the endometrium or the uterus is undergoing repair. Remember, you talked about the ovulation, and that is the time when the egg, is traveling, leaving the other place, the ovaries, and it is coming more so in the tubes where we expect
tubes,
where we expect
to get fertilized.
fertilization to take place. So a failure for fertilization to take place, we anticipate that that egg that was released is likely to be broken down. And just like you say, during the process of menstruation, the endometrium or the walls of the uterus are being prepared, that in case fertilization takes place, there's, attachment. So the walls are prepared, and they are nourished. There is increased blood supply to the walls. So a failure for fertilization to take place, the endometrium together with the unfertilized egg, they are washed out, as blood. So after 2 days, it is actually impossible. But because, science is a dynamic thing, maybe studies are yet to be made. But at this particular time, we expect that is the time when the uterus is repairing itself. After the wash away of the endometrium and the unfertilized egg.
Because we have what we call the menstrual cycle.
Yes.
Normally, it takes around 28 days.
Definitely.
For the normal ladies. So you have to know how long does your menstrual cycle take. Okay? how many days does it take for you to be bleeding? If it takes 28 days, like you always calculate, if today, this August, if August I started on 17th, you calculate the next day, the next month, the day that you started. From the day you started in August, you have to calculate those days to the day you are going to start again in the next month, so that you always know your cycle. How many days does it take? The menstrual cycle has 3 stages in it: the menstruation cycle and the ovulation cycle. Those are the 2 common stages. So during the menstruation cycle, which takes 14 days, normally, it can be 14, which is plus or minus 2. That means it can be 12 days, it can be 16 days. In those days, implantation or ovulation, has not yet taken place. And you can only get pregnant when ovulation takes place. Ovulation, that's when an ova is released from the ovaries and it's getting ready to be fertilized.
Yeah, sure.
So ovulation takes place 14 days from that day you started your menstruation. Otherwise, 14 days from there, you really can't conceive because there is no egg to be fertilized. Ovulation has not yet taken place. So then it can also be 14 days to the next period. You can calculate it like that.
Yeah, sure.
So if you calculate 14 days to the next period, or either 14 days from the first period, from the day you started your periods.
Yeah.
So how do you know? There are basically 5 days, 6 or 5 days when someone can get pregnant in a month. The first day is that first day of ovulation, when the egg has has been released by the ovaries. So that first day, we expect, if fertilization takes place, then someone is going to conceive.
It's going to conceive, yeah.
So you always calculate, if I started my periods on first, you expect at least in between 12th, 13th, 14th day, the 15th day, the 16th day, those 5 days, the possibilities of someone conceiving are high. Otherwise, you can't be in your periods for like 3 days, then the 7th day, or then the 50th day you're expecting to conceive. You will not get pregnant. Or the 5 days to your next period, you will not get pregnant. Okay? The ovulation comes 14 days after your period.
After your periods.
14, that is plus 1, minus 2 or plus 2. That means it can be 12 days, it can be 16 days.
Definitely.
That's why I'm giving a range of 6 days a month. 6 days a month, those are the days when someone can get pregnant. Okay? That's the distance between the last, the date of the period that you had, then to the next one. Okay? So let's say today is 3rd. If someone had their periods today on 3rd, so when do you expect ovulation to occur? You calculate like 14 days from 3rd.
From 3rd.
So you'll be like, today's 3rd, 4th, 5th, 6th, then 14 days. You'll be like, from that 14th day, at least I'm expecting to conceive. If I sleep with someone, I'll get a child.
Well,
but after those 6 days, it's hard. It's hard. We expect if the egg is not fertilized, of course it will get destroyed. The endometrium will start shedding off itself, because like it gets prepared, it becomes thick. Okay? But then after it's not fertilized, it will start shedding off. That's when we see the blood.
Yeah.
So those are the days when someone can get pregnant. It's not every day. Like when I be with a man, someone can be like, I slept with my man, then the following day, I saw my periods. Can I be pregnant? It's not possible.
It's not possible. Definitely.
Yeah, it's like you can get pregnant 14 days from your date of menstruation.
Yeah.
It can be +2 or minus 2. So it can be the 12th day or the 16th day. In between, that is the range.
Okay.
So that's when one can get pregnant.
Besides, Madam Moderator, there is a point of interest there that we are trying to put our focus on when to get pregnant. But there are these people who want to have sex or copulate, let's say, and they are not much interested in being, getting pregnant. These are the people who keep on talking about safe days. What are safe days to you?
So by the way, it depends on your cycle. Okay? That's why I've said you always have to know how long does your cycle take. Okay? That's why I've been giving a range at least from 12 to 16 days.
12 to 16
Okay?
days.
So the day you started your menstruation, so you have your periods for 5 days. So those 5 days, when you're menstruating, of course, you can get pregnant.
That is definitely true. And
so 5 days from the day of the day you start your menstruation, calculate 16 days.
16 days.
Okay, 12 to 16 days. Those are the ones that we call safe days. Those are the days that you will not get pregnant. But there is a range. Can be you can have intercourse on your 14th day and ovulation has already started and you get. So there is a range. That's why you also have to be knowing your days. How long does it take? Does it take 29 days? Does it take 30 days? 28 days? So you have to catch. That's why there is a range, either from 14 days, 12 to 16 days. From the day you started your menstruation. We call them safe days.
Safe days.
So after those days, you can conceive.
Wow. Yes, well, to add something little there at that point, actually, some people, perceive it that it is more likely about 5 days after menstruation, after the last days of the last day of menstruation. And
some even say 7 days.
7 days. And I've actually been interacting with the young women. These are the people who come to you and they're like, excuse me, sir, I was in my safe days and I ended up being with my man. And I thought I was in my safe days, but I ended up becoming pregnant. So this is the little explanation I give to them. When you look at what we call safe days, some scientists don't call them safe days as such. They are safe in quotes, but I don't actually want people to, to rely on them.
That is true.
Yes, that it is true that you can't be pregnant.
They are not 100%.
Yes, they are not 100%. The explanation I give to them is sometimes you look at the viability of a sperm cell. According to science, they say sometimes it lasts about 5 days, and sometimes it can even go up to the 7th day.
Okay.
So this is a time you're going to have sex with someone, thinking that you are in your safe days, and little you know that the sperm is going to last for some kind of long period of time. So you're going to live this so-called 5 days or 7 days, and at the end of the day, the other sperm that was put is not yet dead.
I'm getting what you're saying. I get it.
So at a particular time, this sperm ends up fusing with an egg.
Let's say on the last day, the ovulation occurs, and then the sperm is still there. Then the egg gets fertilized.
So people should take safe days as, in quotes, they are not very safe like they assume. Or just like you said, they can be safe if you actually know how to calculate
your menstrual cycle.
Your days very well.
Yeah.
However, it becomes tricky for some people who have irregular menses.
So this one works for regular menstruation, normal menstruation.
Exactly.
Yes.
Regular.
If yours are not normal, that means you have a hormonal imbalance. Anything can go wrong. If you're not ready to get pregnant, please use family planning.
Use family planning. Definitely that. So the dear viewers, mostly the ladies, should take this as a point that the so-called safe days, in the long run, they may not be safe.
100%
so,
safe.
100%. So if you have irregular menses, you ought to be so careful. If you don't want to be pregnant, me and my fellow, we tell you that use at least protectives or family planning, like she said.
Yeah, there are many different family planning methods. If it doesn't work for you, you can always get one that is compatible with your body. Because if you have hormonal imbalance, that means you might actually have difficulties or problems with the family planning.
Yeah.
So if you want to use a family planning, you always consult, especially if your cycles are not normal. So
Definitely.
that is when someone can get pregnant.
Yes,
So very many
exactly.
people, like say some ladies have wanted to get pregnant, but then they use the wrong days. Someone thinks they'll get pregnant 5 days to the next menstruation. No.
No.
If you are calculating your next menstruation days, you can say 14 days to your next menstruation. That 14th day or the 16th day to your next menstruation, maybe you can get pregnant, or the 13th day you can get pregnant. But after that, it's hard to conceive.
It's hard to conceive, definitely.
So, symptoms of pregnancy. How does someone know that they're pregnant? How will I know that I'm pregnant?
Well,
Me, I'm sure the first thing, you miss your periods. Miss periods. When you've been having your periods properly, and then that day reaches, you're expecting them and you're not seeing them, that like think maybe now I'm pregnant. I think that when everyone knows it. So which are the other symptoms that?
Well, there are quite a number of symptoms. Talking about pregnancy is just amazing because these symptoms vary from person to person.
That is true. That is true.
Before I talk about the symptoms, maybe to be just a little bit clear, for you to confirm that you are pregnant, there is need for you to check out with your doctor. Yes, with your doctor. Some people have personal doctors. If you don't have one, it's much better that you check out from the nearest health center.
Yeah.
Well, symptoms, like I've said, they vary from person to person.
That is true.
But the number one symptom we first look at, as just you talked about it, is
the missed periods.
Yes, the missed periods. This is a time when someone who used to have the regular menses,
the normal
cycle. The normal cycle, at a particular month, you fail to see the menses, you know. So that can be one point.
And you're actually not using family planning.
You're not using family planning. And during that time, you had your man, you know, you were together, slept together, and you know that things happened. So that should be number one symptom for you.
You don't use family planning, you've missed your period.
You've missed your period. But however, missing the period does not necessarily mean that you're pregnant. That's why we say that it's better you check out with your doctor because there are quite a number of factors or a number of things that can cause someone to miss, you know, periods. One of them could be the postmenopausal syndrome.
That is true.
The other thing could be infections.
That is true.
Yeah, last time you were talking about the pelvic inflammatory diseases. Yeah. So the infections can also as well bring that missing of the periods.
Especially the PIDs.
The PIDs.
Or hormonal imbalance.
Hormonal imbalances. Yes, can also cause missed, you know, periods. Then there's this other common one people like referring to, the nausea, and the vomiting.
The morning sickness.
The morning sickness.
Yes.
Someone asked me a question about morning sickness at my facility, and he was like, well, I know the answer, but I want to hear from you.
What do you think morning sickness is?
Morning sickness is, yes. Does it occur in the morning? And I probably told him that this is literature written in the books. We are yet to find out the answers. Yes. But this morning sickness is probably due to, it's common in the first trimester, by the way.
That is true, that is. First trimester means the first 3 months of pregnancy, or the first 12 weeks.
Yeah. During this time, we see that some scientists related to a high concentration of the human chorionic gonadotrophin hormone, the HCG hormone. Yes. Some scientists believe that that nausea and vomiting that we get during the first trimester is actually due to the increased levels. And remember, this hormone can only be detected when there is an implantation already.
Yeah.
You know?
Yeah, there is actually, when someone gets pregnant, there is a rise in HCG is produced. It's produced, there is a rise in estrogen, becomes more than the normal.
Yes.
And then HCG is also getting produced. So the hormones are high, these two. So we expect such changes coming.
Yes, such changes. And then another symptom, I'm using this.
No, first talk about morning sickness. Morning sickness, does
yes,
it always happen in the morning? Because me, I think it's not only in the morning. It can also go throughout the day, though it is very common in the morning. You wake up feeling nausea, you wake up feeling like though you want to vomit, and some vomit. Nausea is like the urge to vomit, and someone can end up vomiting.
Yeah.
Though it's called morning sickness, it does not only happen in the morning. It can go throughout the afternoon and evening, depending on someone.
Yeah, exactly, depending on someone. Well, I think I wish the person who asked me this question was viewing this program because you've actually given a very good answer. People perceive that morning sickness occurs only in the morning.
It can go even throughout the day.
Throughout the day. The other symptom, we actually look at fatigue,
tiredness, someone feels tired, weak.
Exactly.
Because there are changes going on in the body.
In the body.
Yeah, there are hormones rising that have not been there normally.
Yeah.
An offspring is growing into you, so you can't stay the same. So someone can feel a lot of fatigue.
Definitely.
Or tiredness, let's say.
Yes. And then the other symptom that we normally look at is the spotting. Yeah, the spotting. It's not the other flow, we know, the normal one. But what is spotting to you, by the way?
This is when someone gets spots of blood. Blood comes out of your vagina.
Definitely.
That is spotting. It
Yes.
can be during different occasions. So in this case, we're talking about pregnancy. So some people do get spotting during pregnancy?
Yes, they do. It is, according to scientists, they say that spotting is attributed to that time during implantation. Yeah, after, the egg is fertilized, and during that time when it is, attached to the walls of
it's moving along the fallopian tubes, getting attached to the uterus.
Yes. So during that time, like we say, these symptoms vary from one female to another.
So someone can have spotting,
yes,
someone cannot have
some cannot. But it is attributed to during that time when, an egg is being implanted on the endometrium.
Yeah,
yes.
There is also increased of frequent urination. When you find yourself urinating very often, it's also a sign of pregnancy.
Sign of pregnancy.
Though it can be a sign of a UTI, but in pregnancy, it's a normal thing, unless you get some other infections. Yes. Frequent urination, it's also common in pregnancy. Then some other people can get pelvic pain. You feel some crampy pain. You think of other periods are coming or they are not coming.
Yeah, I know.
Some people feel it, but actually when you're pregnant.
Actually, at that point, some people attribute it to the fact that since there is an introduction of something new, and when you look at the anatomy is a structure of the uterus. They say it is usually thin, thin, but as there's introduction of something, there is increased, it thickens, and there is hypertrophy of the uterine muscles. So sometimes that pain is attached to the expanding of these muscles, and at the same time, introduction of something new in the uterus. So that back pain and that lower, abdominal pain, sometimes it is attributed to that.
Yeah. So basically, not after 3 days or 2 days, you go for a pregnancy test from the day you conceived and you think it will be positive. It takes sometimes at least 10 days, 2 weeks, basically 2 weeks. We are sure when you use a urine dipstick, the common ones, the HCG will be there within the 2 weeks.
Definitely.